What is a situation where you would prescribe sleeping pills? And are they effective, a good thing for people to do?
So here's what I'm going to tell you is I don't think we can say they're good or they're bad. I think there are people in this world who need a pill to sleep. I don't think there's anything wrong with that. I think they're overprescribed. I think too many people use it as a crutch, are not using it appropriately. Let me give you a few examples. So number one, when we're looking at sleeping pills in general, the problem is there's so many different types. There's what are called the benzodiazepines. Then there are the non-benzodiazepine hypnotics, which is like basically newer technology. When you talk to doctors don't like to prescribe sleeping pills. Why? Because patients become addicted to them. Now, there's a big argument within the literature of, is it a physiological addiction or is it a psychological addiction? I don't think it matters. Here's the bottom line. If I give you a pill and you haven't slept well in 20 years and you sleep well, you're going to want that pill again and again and again, whether your body tissue is addicted to it or not, right? So if that's the case, then we need to be thoughtful in how we utilize these compounds. If people have the ability to learn how to sleep without them, then that is the direction that we should take them. However, if you're a paranoid schizophrenic and you need a pill to fall asleep every night, I'm just fine with that. Right? So severe mental health issues, severe pain issues, severe medical issues, all of those are ripe areas for appropriate use of sleeping tablets. Whatever one you want. I would argue you want to use the latest, greatest technology if you can. Most doctors, if they're going to prescribe something, actually like to start with something called a sedating antidepressant, like trazodone or Remeron, which are two medications that are not highly addictive, but do make people feel very sleepy. So folks out there could easily be prescribed one of those. Not a bad thing to be on. By the way, they're not addictive and you can be on them for extended periods of time. So it's not the worst spot to be in. But I only really like to use pills to kind of break the cycle of insomnia. And I will tell you, you have to have people on them for about 90 to 120 days. So you're talking 3 or 4 months to just get them in a cycle where they're doing well. And then usually during the last 30 to 45 days, we start to slowly taper the medication while giving them very specific guidelines on sleep scheduling, on sleep hygiene, on sleep bedtime routines. So that way, when they get to the point where we have them off the drug, they're sleeping naturally. That is the perfect process for somebody, especially when somebody's in a spiral for bad sleep.